Hello, everyone. I want to welcome you all back for our second panel entitled 5 Years of Progress, Federal Action to Advance Maternal Health. Lord. Thank you all so much for joining us. I hope everybody is sufficiently caffeinated. Yes. So excited to have you all back, and thank you everyone who was on our first panel as well for starting off this summit to just such an amazing day. This will be our final panel for the morning, and we're very excited to get started. As many of us know, it would be impossible to make progress on maternal health in our country without the committed work of public servants and community stakeholders like yourselves. I am so happy today to have some of these key government officials with us to talk us through this, to talk us through the federal work that they've been doing to advance this issue. And joining us today, I'll do brief introductions. We have Chiquita Brooks-LaSure, Administrator at the Centers for Medicare and Medicaid Services, also known as CMS. Administrator LaSure oversees programs including Medicare, Medicaid, the Children's Health Insurance Program, also known as CHIP, and the Affordable Care Act health insurance marketplaces. She is a former policy official who played a key role in guiding the ACA through passage and implementation, and has decades of experience in the federal government on Capitol Hill and in the private sector. We also have with us today, and just for those of you who are not aware, she's in this beautiful blue suit right here. Yes. We also have with us today Carol Johnson, who serves as Administrator of the Health and Resources and Services Administration, also known as HRSA. Administrator Johnson joined HRSA from the White House COVID-19 response team, and she previously served as Commissioner of the New Jersey Department of Health and Human Services. She also served as a Domestic Policy Council public health lead in the Obama White House. She has extensive experience on both Capitol Hill and in executive agencies working on healthcare issues that include workforce policy. And she's right here next to me. Our next panelist is Nikayla Cook, who is Executive Director at the Patient-Centered Outcomes Research Institute, also known as PCORI. Dr. Cook is a cardiologist and health services researcher with a distinguished career leading key scientific initiatives engaging patients, clinicians, and other healthcare stakeholders at some of the nation's largest health research funders. Dr. Cook leads PCORI's research engagement, dissemination, and implementation, and research infrastructure development work. She also provides oversight to a growing number of programs and initiatives at PCORI. Last but not least, we have Dr. Yvonne Bronner, head of the Maternal Health Equity Coordinating Center at Morgan State University. Dr. Bronner is currently a professor in the Department of Public Health in the School of Community Health and Policy at Morgan State, and she has conducted research on how to increase breastfeeding among African American women, as well as involving men in the promotion of breastfeeding and family health. In 2023, Dr. Bronner also became the head of the Maternal Health Equity Coordinating Center, dedicated to helping researchers within the 16 MSIs that are part of the HRSA Maternal Health Equity Collaborative build their skills and ensure that their findings are put to practical use in those communities. This collaborative is the first of its kind and part of the Momnibus Act, so I'm excited to have Dr. Bronner, who is down here in the lovely red, with us today. So, yes, let me give them. All right, so now let's get started. My first question is for Administrator Brooks-LaSure, Administrator Johnson, and Director Cook. I want to thank you all so much for being here with us today. This year, the Black Maternal Health Caucus celebrated 5 years of existence, which, hand clap for that. It's been such an honor to have you all as partners in this work, and so I'd like for you all to share a little bit about the institutions that you lead and the work you are doing with the Black Maternal Health Caucus and the progress that we've been able to make over the last 5 years.
Well, I'll start and say just a huge thank you for inviting me to be here with you all today, and thank you for all of your leadership in one of the most important issues of our nation. As you heard, I am the administrator for CMS. CMS now covers over 160 million Americans, so almost 1 in 2 people in this country, through our programs. We also are responsible for public health and safety over many of the facilities in this country. And so when we think about maternal health, we often think about Medicaid and CHIP. 40% of births in this country are covered by Medicaid and CHIP. And in some states, it's even more than that, where nearly half of all births are paid for by the Medicaid program. And it has been just a very important issue for me, for everyone at our agency, and the entire administration to really focus on what we can do to address the disproportionate outcomes that we see for Black and brown mothers in this country. And I always like to say, it's really important that we know that this is not just income-based. We see these same disparities when you look across women with coverage and education. So our programs, Medicaid, one of the very important focuses of the Momnibus, the caucus, was getting postpartum coverage for women. So before the focus of this administration and this Congress over the last couple of years, most women who were pregnant were covered in Medicaid just up to 2 months after you gave birth. And we know, those of us who have children, what it's like 2 months after you give birth. You are juggling so many things. And the idea that you would then have to go figure out a new insurance coverage, figure out, does your doctor participate, and try to get all those appointments. We were seeing many women fall off of coverage. And many of the deaths in maternal health happen postpartum, as well as, of course, at birth. And so it's been a priority of the caucus and certainly our administration to cover women postpartum. And we now have 46 states, only 4 left, who are covering women for the entire year after. And every time I see the vice president, she says, when are we getting to 50, Chiquita? Another important piece that we, among other things, that our agency has been focused on has been on trying to improve care at the point of of delivery. And we started a birthing-friendly designation. And I'm really proud of this for a couple of reasons. One, because there's been so much private-public partnership in our birthing-friendly designation. We started this in the Biden-Harris administration, and many private companies liked this concept and really have partnered with us to really encourage hospitals to meet the standards that we are setting forth of having a collaborative, of implementing best practices. And we continue to encourage the public to give us more suggestions about where we take that birthing-friendly designation in the future.
Administrator Johnson, Director Cook. Yeah.
Thanks so much. I'm Carol Johnson. I'm the Administrator of the Health Resources and Services Administration. Can you hear me now?
To your mouth.
No. Can I trade this? Okay. I'm Carol Johnson. I'm the Administrator of the Health Resources and Services Administration. We are the part of the Federal Department of Health and Human Services that focuses on maternal and child health services here in your state and counties. We help support what happens in communities across the country. We also fund workforce development programs, rural health care services, community health centers that treat people regardless of their ability to pay, the Ryan White HIV program. We are basically laser focused on getting healthcare services for people who have historically faced too many challenges accessing healthcare. And so we are, by definition, part of this fight. And so when the president and vice president came into office, you know, they looked at the data showing that the United States had one of the worst mortality rates in the developed world and said, this is just completely unacceptable. We have to change this. And fortunately, it aligned very nicely with our colleagues in Congress launching the Maternal Health Caucus, which meant we had champions who were able to, and partners to do this work with. And so Congresswoman Underwood and her partners have just been such terrific partners as we work to grow our programs to tackle what we know works. So what are some of the things we've done? We've grown the workforce. There are more community-based doulas. We've trained more midwives. We are training and placing more OBs and in communities that have historically struggled to have access to OB care. We have focused on, hospitals regularly train in, okay, if you're doing left knee surgery, what is the checklist to make sure you're doing left knee surgery? Those kind of protocols can be adapted for obstetric hemorrhage. Does everyone have a crash cart? Does everyone know how to use the crash cart? Are we ready? We've built hospital-based models to be able to integrate those kind of quality practices into hospitals. And then Chiquita and her team have rolled that into the birth-friendly designation model. We focused on what happens postpartum. There's a ton of focus on what happens in the clinic walls, but what happens postpartum? Are we really ensuring that there's access to maternal depression screening? Are we ensuring that we actually can wrap around folks when they need those kind of services and supports? So we support a host of community interventions, including our Healthy Start program and our home visiting program, because we find again and again what's incredibly important is having a trusted messenger, a trusted partner in this work, whether that's a doula or a community health worker or a home visitor or a nurse or a social worker. Being a new parent is hard. Being pregnant is hard. Having someone you can trust, who can be your voice, who can help be your advocate in a system that frankly is too hard to navigate, that we can make a real difference with that. And so we have been really excited to support the expansion of the home visiting program in this administration, to support a whole host of new awardees in our Healthy Start program. That's a place where you can call up and you need diapers, you need food, you need support, being able to get a new lease, to get an apartment. All those kinds of things are available through our community-based interventions. And then thanks to the caucus, we were able to launch our health equity research collaborative that Dr. Bonner will talk about. So we're really proud of the partnership and the ways that the caucus and this administration have been able to work together, frankly, to really just put the wind at the back and lift up the work that you all have been doing in the community for decades.
Thank you. Yes.
Thank you.
Thank you.
I just wanted to begin with a thank you for the invitation to be here. It's such an honor to be in this room with people that have really made their life's work what we find to be so important for us as well at PCORI. So I want to tell you a little bit about PCORI. We're a little different than what you're hearing from some of the other federal agencies that are here. We're not a federal agency. We're actually an independent nonprofit research funder. And we fund the type of research that really tries to provide actionable information for people, for family, for patients, for those in the health and healthcare community to make the choices that they need to make about their health and healthcare from an evidence base. And the work that we fund is really called comparative clinical effectiveness research. It's research that tries to compare two or more different types of strategies or options for the prevention, the diagnosis, the treatment, the monitoring of health and health issues. And we have long been interested in this really remarkable disparity that we see in this country related to maternal mortality and morbidity, but it's also one of our 12 topic themes of focus funding. So we have a long-standing interest in the work here. We have that also in our authorizing law for federal funding, and so we promote the work in maternal morbidity and mortality from that basis of thinking about comparative clinical effectiveness research, which we think is inherently equity-minded because it really takes the issues that are important to patients and their families and caregivers and others and tries to think about what works best for them in the circumstances that they're in, really about thinking about how the research works to serve those we're interested in serving. We have funded over the years almost 100 different research and research-related projects related to maternal morbidity and mortality, over $300 million worth of research funding. And we continue to make an effort to think about how that research is done in the way in which PCORI does research differently, which is engaging with patients and stakeholders to help define the questions and the issues that are most important to them. to make sure that we're thinking about not just the research, but how we get that research across the finish line, the dissemination and the implementation of that work, the findings, and getting it to those that we're trying to serve. We also fund research infrastructure to utilize data systems that can help us with the research that is going to be faster and more effective for populations that we're trying to reach. I'll also mention that one of the exciting areas that we've recently funded is something we've called the Partner Initiative. And it really exemplifies that approach to research done differently, because in this initiative, we've recently funded 4 awards, $80 million worth of funding, to examine the issues related to maternal health and maternal health disparities. And particularly here, we have communities leading in partnership with researchers to make sure that we're understanding the issues in the community that are important for us to focus our funding. And these awards, I think, are very different because, number one, there's a co-partnership and co-leadership that just exemplifies what we need to do to make sure that we're funding research that works for people and communities. Number two, the interventions in these projects are actually focused not just on health systems, but also the social determinants of health that really drive a lot of the issues that we know drive our inequities in this country. And the third thing that's really different about this work is we're building a network of learning amongst the awardees to make sure that they can benefit from what we learn in one community to another community. So we're really dedicated, excited about the work that's underway. We think we have opportunities to really change the narrative here. And I'm excited to be here with all of you and happy to tell you more about it as we discover more on the panel.
Thank you. So, I just want to let you all know there was no way that we were going to have a panel on federal action without talking about federal dollars. And I just have to say that because it's so important to this cause, and we've already, through the Black Maternal Health Caucus and through the work of Congresswoman Lauren Underwood, who is not with us today, but who serves on the House Appropriations Committee and has committed so much of her work and her time to securing these needed federal dollars for causes like this, and how important that has been in the work that we've been able to do and the research that we've been able to conduct. I'm shouting her out a little bit more maybe than she might want, but I'm just gonna say, you heard it on the video, I just wanna reemphasize that through the Black Maternal Health Caucus and the work that Congresswoman Underwood has done on the Appropriations Committee, we have, over the past 2 years, secured more than $200 million for Black maternal health research. And that is important as we're moving forward. And of course, later on today, she would pinch me if I didn't mention this, but of course, later on today, we will have a panel on talking about how to secure those federal dollars. But it's important to see where they're going and how the work that how they're being used in the field. One of the biggest challenges in our maternal health crisis is the lack of reliable, comprehensive, unbiased data, and the Data to Save Moms Act in the Momnibus is designed to fix that. 3 years ago, the Congresswoman, when she joined the Appropriations Committee, and over the last 2 years, has worked to create new federal funding stream based on the Data to Save Moms Act. They've gotten $20 million so far, and that money has been used to create a national research network at minority-serving institutions to help those data groups. Dr. Bronner, you know this question is coming for you. Congresswoman Underwood has been so delighted to partner with you guys and to work with you, Dr. Bronner, as you lead that network at Morgan State University in Maryland. It's not my HBCU, but I support it being an HBCU. So can you tell us, Dr. Bronner, more about this new research network and the universities involved and what you're working to accomplish?
Thank you so much, Brittany. I am so excited that I have to begin by thanking the representatives Underwood and Adams and my dear friend Carol Johnson from the Hearst administration. I want to also say a word of thanks. I never have said this before, but to my colleagues at MCHB, Michael Warren, Laura Kavanaugh, and Lauren Ramos. They worked with us for the whole year as we were trying to move them toward this investment in our HBCUs. And I am going to also take a minute to thank my staff, because we have done a lot of work in 10 months that I'm going to share with you. I did not do it alone, and I'm just going to mention their names quickly so they can not do something to me when I get back. Desiree Johnson, Tyron Rice, Lisa Bailey, Sierra Lee. We also have 3 partners, Carolyn Belcher from Kennedy Krieger Institute, Stacy Tuck from AmChip, Liz Taylor from Westat, and India Bowers from our Systems Science Group. And you're going to hear me speak about them, but I wanted to give a big shout out to them because I wouldn't be here without them. My co-PI for this initiative is Keisha Baptiste Roberts and Dr. Maya Anderson, both from Morgan State University. And so I'm going to be sharing with you about the Maternal Health Network for minority serving institutions, and are there any HBCUs in the house? Yay, I figured you were here. We are so proud to be representing 16 of our research centers. Many of them are HBCUs. And I'm going to just read the list because 16, I couldn't dare to remember all of them. And this flyer is also available for anybody who would like to get a copy of it. But in Alabama, we have Tuskegee, and we have Loma Linda in California, Florida International. In Georgia, we have Morehouse School of Medicine, the University, all right, Morehouse in the house. University of Hawaii, Morgan State University in Maryland, Tougaloo from Mississippi, Mercy University. Ohio State has 3 partners, the District of Columbia, Howard University. All right, Howard in the house. And then Albizu University, both located in Florida and Puerto Rico. Tennessee has 3, Meharry Medical College, the School of Graduate Studies, Meharry Medical College, the School of Applied Computational Sciences, as well as Tennessee State. And in Texas, Texas being big, they have 4. Texas A&M University, Texas Southern University, University of Texas Arlington, and Texas Rio Grande. And what you notice is that we have HBCUs as well as MSIs represented. And so what are we doing? Our work we have 4 objectives. The first one is to facilitate the capacity for our HBCUs and MSIs to conduct maternal health research. It was noted that we're in the data component of the Momnibus, and we are all about research. But our institutions have not been engaged in this research, so we're here first to grow that capacity. Secondly, we are looking to the future by having our early stage investigators, and so I'm going to be talking about several initiatives in mentoring. Number 3, we're about data. We have a very strong evaluation component supported by Westat. And then finally, we're going to be looking at how we can focus on climate change, because you know that is a very big component of the health and well-being of our mothers. And so what are we doing? The first thing that we're doing is to center and nestle our work in 2 very important frameworks. The first is the National Academy of Sciences Community Engagement Framework, and that framework allows us to work from the bottom up, where we have authentic community engagement informing our work. And then secondarily, we have the CDC Knowledge to Action Framework. These frameworks are allowing us to focus on effectiveness versus efficacy types of studies, so that we can have interventions that can be moved to scale, and then we can have dissemination of this work in our communities. And so we're very excited to have our work nestle in those 2 very important frameworks. And then the next thing is that we are taking the first leaf in the petals of the ACE, and that is developing community. And community is at multiple levels. And the first community that we're developing is the community of our RCs. And our RCs are working together. We started in September. We met with them in the fall of 2023. And we have met with them by Zoom. And then we had a face-to-face meeting in the spring, and then another face-to-face meeting at Morgan State University in June. You know, Zoom can go so far. But at some point, you got to touch people. You got to actually look them straight in the eye. And that's what we like to do, and that's what we were able to do. And then the next thing, we have been fortunate to partner with the Association of State Public Health Nutritionists that has had a 20-year program with Dr. Steve Owens, where they have been working with students to tell them about public health. We now have added the maternal health piece. And so what have we been able to do? We have been able to have those students become a part of the next community. Remember, we're forming communities. And that community of students have done two things. In the spring, 24 of them were able to work for 15 weeks together, and then they went for the first time to a national meeting in St. Louis. A lot of these students had never been on an airplane. We're working with students who don't come, with a gold spoon in their hand. And so it was just wonderful to have them in St. Louis at this meeting. We also met with our RCs at the same time, so we had a face-to-face. The students, in just that short period of time of one semester, were able to develop posters that they presented as well. We moved that same model forward into a summer mentoring program where we had 22 students from our RCs engaged, and they worked very hard. In this 8-week period, they reviewed 18 articles each, 18 journal articles each, and then they had a closing ceremony where they did poster sessions. And then they're going to take those annotated bibliographies and move them to publication. We are all about deep science here in this work. And then finally, we have been engaged with several convenings. We had the convening with our own Administrator Johnson, who came to Morgan State University, where we were able to look at what is going on in maternal health in the state of Maryland. We also have worked with Region 3 and Melissa Hurd, where we have had a convening with them at Morgan. I presented at Norfolk State, and now we're going to have another convening as we move into November. So we have been very, very busy. And I have lots of ways that we can use that additional money that is coming down the pipe. Thank you all so much.
Thank you, Dr. Bronner. Administrator Johnson, this is the first time ever that the federal government has directly funded HBCUs and minority-serving institutions to do this kind of work. You'll see, all of you all, there's a full map in your folders that Dr. Bronner already went over that kind of outlines where some of that funding has gone. Now, a lot of that extra $200 million that we've secured through the appropriations process, as previously mentioned, is managed by HRSA, including Dr. Bronner's program. Could you tell us more about the incredible work that HRSA is doing with this funding, from innovation grants to training more doulas and midwives?
Yeah, thanks so much. I mean, you all see why Dr. Bronner won the competition, right, to be the lead agency. We are so proud to be the home of this work, with thanks to the caucus for helping to secure these resources. We do this in a competitive way. We said, okay, we're going to build this network. Folks should come in with their ideas, and folks should come in with their capacity to tell us who should lead this network. And so Dr. Bronner and her team at Morgan State are leading that work. You see what a difference it makes. I like to think of it as like there's ivory tower research or bench research, which is incredibly important. And we need to make sure that we're working really hard, that people from all communities are part of that work. But there's also community-based research. There's what works in the community. There's how do we start to identify things that are promising practices that we can then roll up into our grant programs and be able to spread to other places in the country. I don't need 3 double-blind or randomized control trials to be able to show that. I need good evidence that it's working in the community. And that's what Dr. Bronner and her team can build, while they're also building the capacity of these smart young students to actually get on that academic research track, and be able to be the future of academia and be the future of research. So we're so pleased to be in this partnership. We think it's going to make an incredible difference. It is a 5-year, $50 million investment that would not have happened but for Congresswoman Underwood and her leadership in the caucus. We also, so one of the little secrets about Washington that no one tells you is that you can have a big legislative bill to try to move big ideas forward. But while that's happening, you can also work the money on through the Appropriations Committee. And that's what your Congresswoman has figured out a long time ago and recognized that she's using her voice and platform, the caucus is using their voice and platform to advance the Momnibus, but at the same time, there are opportunities to advance the resources for those ideas through the appropriations process. And much of that money, as you noted, has come to us at HRSA. So in addition to doing the work that Dr. Bonner's team is leading, we also are expanding access to maternal health services in rural communities, thanks to those investments. We know, I mean, you just have to Google labor and delivery and you'll see the challenges that rural community hospitals are facing. You'll see the challenges, frankly, that suburban and urban community hospitals are facing when it comes to labor and delivery services. So us having the resources and capacity to help those types of facilities do the work necessary to figure out how to sustain those community-based services. There's no reason why in the most developed nation in the world you should have to drive long hours to get to a delivery site or be delivering in an emergency room where people aren't prepared. We need to make people prepared. We need to make it possible that access is as important as coverage. And that's what we're committed to doing. And then, one of my personal passions, and one of the things I know the caucus is very focused on too, is early engagement in prenatal care. We know that the earlier that someone's engaged in prenatal care, the better we can do for them. But that is a challenging thing if you have to take off work and lose a couple hours of your salary and find childcare for your kids and take 3 buses to get to an appointment. None of that is patient-centered. Patient-centered is being accessible and available at the hours that are convenient for you, having a culturally competent healthcare provider who looks like you. All of that is the work that we're doing by investing more in our community health centers, by investing more in the health workforce, by creating pipelines to help young people from HCBUs and MSIs become maternal health providers, become maternal mental health providers. We need to change the face of the work that we're doing, and that's what we're committed to doing with you all.
Thank you so much, and we appreciate that work. We've made so much progress over the last 5 years, and it, to me, has become overwhelmingly clear that we need the full Momnibus passed. I'm not just saying that because she's my boss. I'm saying it because it's true. That is the only way to really, really address and end this maternal health crisis that we have in our country. From workforce investments to improve maternity care payment models to investments in social determinants of health, the Momnibus is comprehensively designed to end the maternal health crisis. We had a unique chance, I think, last year to try and get it passed, and we got so close, and we are still working to get it passed this year, and I really do believe that we have a unique opportunity to make that reality. My last question is for everyone on this panel, and I just want to know, what would the future of maternal health look like for you in this country? With the funding and policy changes in the Momnibus, what could you and your teams do for moms and families in 2025 and beyond?
So I would just say that I think there is a different awareness than there was 5 years ago about just what a critical crisis we have in our country. And I think that it will always take private and public work to really move the needle. Administrator Johnson just talked about so many of these pieces of making sure we have the workforce that we need. One of the things that I think I see so much is really getting all of the best practices that we already know actually delivered in care. And one of the third pieces that our agency is working on is we have our Innovation Center, which is a place where we can do models, where we are trying to help states in their Medicaid programs focus more on some of these best practices, get the data, and also really build up their relationships with the community. And that focus of making sure we are including everyone at the table when we try to come up with our solutions is one of the most critical things that I think we need to continue to do to make sure it's embedded into when people are getting insurance coverage, when they're seeing their doctor. One piece of ours is really making sure that the states that take the funding for us, which is available for 15 states, $17 million each, if they have a couple more weeks to apply, so find out in your state if they are applying for our money, to make sure they're integrating doulas and other community-based organizations into thinking about how do we move the needle on maternal health.
I may add a slightly a different perspective, just because our organization doesn't make policy or policy recommendations, but we do generate the evidence that we hope will inform policy and policy recommendations. And so one of the things that I think about is even when I talked earlier about this partner initiative where we're seeing the co-leadership of communities and researchers really tackling the problems that are at the heart of what the community sees are important to address. An example that comes to mind is one of the programs we funded that's called the Thriving Heart Study, where at the patient level, this is a study that's focused on trying to prevent the adverse outcomes related to hypertensive disorders of pregnancy. And at the patient level, they're making sure that patients have the ability to monitor their blood pressure at home by providing them with home blood pressure monitoring devices. And at the community level, there is engagement of community health workers as part of the health system that helps an individual in a community take care of each other. And at the health system level, there is trauma-informed care that's being thought about for the providers that are actually facing a lot of burnout in this country and a lot of challenges in dealing with the clinicians that are trying to deliver services to communities. And I use that as an example of what I think the future could look like for us, because I think if we are, from a research perspective, thinking about the questions that really matter to patients and communities, and we address those questions in ways that leverage the data and the available information that may be sitting in our communities and in our health systems, and we ask those types of comparative clinical questions that help people to understand the choices that may work best for them given their circumstances. And we work to move that into implementation and dissemination so that everybody who needs to know the information has it available. Then we have the opportunity to improve maternal health outcomes for all people. And I'd love to see a future where that type of integrated research and clinical practice that's very patient-centered, community-informed, is the way in which we continue our work forward.
Okay. Did I go now? Well, because we're about training for the future, one of the most important things that I have already applied for additional supplement for is a fatherhood initiative. Hello. My vision is of families, and probably some of you recognize that our families are in a state of disarray, and this is before we have the onset of AI that's coming in to change the way we live, work, and play. And so I really would love to see an initiative that is focused on families and with a fatherhood leadership of this. The second thing that we have to do is bring all of the work that is being done within our communities together. And so I am advocating for system science. We have a system scientist working in our group, and this is one of the few places where we have in public health a system scientist. And even in our group, everybody is asking, well, what does she do? And how does this work? So we want that puzzle piece to become a reality in terms of bringing the many pieces together so that we can have synergy, we can have an optimal outcome for all of these investments that are being made. And then the third thing that I would love to see is when our early stage investigators are changing the face of the workforce at very high levels. And so we are educating them at both the master's and doctoral levels so that when they go out, they can take on leadership positions within the area of maternal and child health, and so that the future is going to be such that when people walk into rooms, they will see people like them. And these will be at client levels, but also at community leadership levels, which brings me to my last point. We want to empower our community cabs, and we want to pay them fairly as they invest in our work. Our work cannot be from the bottom up if we don't pay the people at the bottom. Thank you.
I think the shared goal we all have is really for a lifespan approach here, and that includes, starting from women having bodily autonomy and reproductive rights and freedom, women having the ability to get access to affordable health care, as my CMS administrator colleague has mentioned. So that's the Affordable Care Act, Medicaid expansion, so that we control hypertension, we control diabetes, we get people early access to mental health services, we get people substance use disorder treatment in a timely way, early engagement in prenatal care that's accessible, affordable, and works for families, and that is reflective of the communities that they serve, a healthcare system where you can access maternity care services readily in your community, community-based services and supports like doulas and nurse midwives and community health workers, and a postpartum system that is about the mom as much as it's about the baby.
Thank you all. This has been such an informative panel. I want to reiterate for those of you in the audience that the caucus has done the work of securing this funding, but guess what? You all have to go out and get it. I want to further emphasize that I don't want any of you all to be intimidated by applying for federal grants. There are opportunities out there for each of us, for each of you, to help your institutions, to help your communities, and there's help available for you to be able to do those things as well. Even if you've never applied for federal funding before. Research the agency, get the help with technical assistance, reach out to your federal and local and state representatives. I know the people of Illinois' 14th District have a congresswoman who would be willing to work on their behalf in this space. And I'm sure there are so many others out there. So please continue to do that. We've heard so many wonderful things about what CMS is doing, about what HRSA is doing, about what PCORI is doing, about what Dr. Bronner and the HBCUs are doing to advance research and work in this space, whether it be health insurance coverage, whether it be access to funds that will allow stakeholders in our communities to do the research needed to end this crisis. There is more than enough room, more than enough space, more than enough opportunity for each of you to lean into this. That's a pause for dramatics. Please be intentional about exploring the opportunities. Go to the Black Maternal Health Caucus website, stay updated with what we're doing here, and reach out if you have questions. Also, we have a panel in the afternoon, so please join us for that. As a concluding remark or a concluding statement, I would like each of you, if you wouldn't mind, just provide a phrase or a sentence about what you would like the audience to take away with them today.
Oh, I hope that it's hope. I feel like we all share a common goal and we're all leaning in hard, and I hope that you see in the Biden-Harris administration that we are with you in this fight and that we have hope together to change the outcomes for moms.
I like that one. I would say community, that no mother in this country is alone. It is a community, and we're going to solve this together.
I also think that collective action is something that is really resonating with me from today, and that we all have a role and a part to play in this. And I hope you learned a little bit about PCORI as well. And we will have someone on the panel later, and we're interested in helping you think through the questions that may be appropriate to send our way, because we're really engaged with all of the communities that approach us, and we're really interested in engaging with you.
Our HBCUs and MSIs may be late coming to the table, but we're now here. And we are going to be building our initiatives from the ground with all of our people working together in communities that are fully and authentically engaged.
Thank you all so much for your participation. So that concludes our panel for this morning. I will just highlight for each of you that it is now time for lunch, and there are food trucks in the parking lot across the street, and you are able to eat in the Joliet Museum as well. So please join us for the afternoon sessions. There are schedules available to each of you, either in your folder or downstairs. Feel free to ask staff. And I look forward to seeing all of you this afternoon.